health emergency that has sent kids across the country into the intensive care unit. It's a very rare respiratory virus, and we're going to talk to our Dr. Richard Besser about it in just a moment. But first, ABC's Clayton Sandell.
This morning, it's a mystery respiratory virus.
I was having trouble breathing.
Striking more than 1,000 children across 10 states.
The onset of symptoms was very rapid, usually within hours.
Doctors believe something called enterovirus 68 may be the culprit, linked to the common cold.
To go from a cold to, being probably minutes away from death, that's kind of scary.
It can cause wheezing and is especially dangerous in children with asthma.
My head started hurting after my lungs started sort of closing up.
13-year-old Will Cornejo, who has asthma, got what he thought was a simple cold that turned out to be much worse.
He came really close to death. He was unconscious at our house and white as a ghost, blue lips.
Now recovering at Rocky Mountain Hospital for Children in Denver, Cornejo is making progress, but doctors still have no clue as to what is causing the rare virus to spread in the first place. For Good Morning America, Clayton Sandell, ABC News, Denver.
And so we're going to bring in ABC's Dr. Richard Besser, who's been talking to the CDC's director of the Division of Viral Diseases. Good morning, Dr. Besser. And first of all, 10 states asking the CDC for assistance. We don't even know for certain what this is, but why now? Why is it happening?
Well, this is a very common time for outbreaks. Kids come back to school. They like to share things. They bring them home to their little brothers and sisters. And enteroviruses tend to occur in the summer. But this one, this particular enterovirus 68, is very rare, and they have no idea why it showed up this year.
It's tricky because you say the symptoms can mask that of a common cold. So what should parents be looking for, and how dangerous can this be?
It can start just like a cold. So runny nose, sneezing, coughs. But it's the wheezing that you have to watch for. It's that wheezing that can be very dangerous. And in particular in children with asthma, you want to watch for that wheezing. But it can cause wheezing in other kids too. So if a cold goes into difficulty breathing, get help right away.
Of course, it's difficult to treat a virus. You have to contract it first. But what's the best way to prevent?
Well, prevention, we talk about it all the time. Hand washing is critically important. That's how these are shared. So good hand washing, covering coughs and sneezes. Keep your children home when they're sick so they don't share it. And if your child has asthma, make sure they have their medicine. And if you hear that wheezing, get them to see their doctor so that they can avoid some of these complications.
And so far, 10 states. We looked at that map. Looks like it's just a couple of coastal states, North Carolina and Georgia. But what about this possibly spreading more?
Well, we talked about this. I talked about this with the CDC. Viruses don't tend to respect borders. It's only 10 states now, but it's going to be across the country. So if your state doesn't have it now, watch for it. It's coming.
All right, parents, be vigilant. Dr. Richard Besser, thank you so much for that this morning.